Welcome to Vedhika TV viewers. In our daily life, we must have faced many issues or injuries or pain related with foot, ankle or joints just by walking or running or just by mopping the floor. What we do at that time? We just apply painkillers or consume pain tablets. But how effective it is? Let me introduce you Dr. Pradeep Moonot, who is a renowned orthopaedician working in Mumbai and Hyderabad. He is super specialist in foot, ankle and sports medicine. Let us talk to Dr. Moonot and know much more details about it. Hello, doctor.
Hello,
How are you, doctor?
I'm fine. How are you?
I'm good. Many people suggest like barefoot walking is very good. Walking on the grass is very good. So what do you suggest?
I think it's a very new Western concept, let's put it that way. Because in India, I don't remember when I was growing up, I was using chappals at home. All our ancestors, look at all the houses, big houses, people would be walking barefoot. I think it's a very good thing. You can activate your senses. Feet have receptors, so they activate it. Of course, barefoot walking helps in developing your foot muscles, help in your proprioception and joint sense, helps you develop your biomechanics of your feet very well. They are very good. Barefoot walking helps in developing the arches as well, which is fantastic. And because of that, also your knee alignment and your back alignment is better. That's all well and good. Of course, walking on good surfaces, grass, or a turf is good. No doubt about that. But hang on, only the solution? I would say no. You have to be careful where you're walking. Now, suppose you start walking barefoot on a tar road or a cement road. I think it will cause you more damage than good. Okay. Also, you have to be careful if you're going barefoot walking on the road. There are objects which are there. It could have a glass piece, cuts, or anything, and which can go in your feet and cause you infection. So just be careful. Also, one of the most common things which I see people walking barefoot, especially in public places, saunas, swimming pools, they catch infection, they catch warts. So that's another downside to it, fungal infection, not a very good thing to do. And also depends on the type of a feet which you have. People who have a very bad deformed foot or a flat foot, or people who already have an existing some mild heel pain, you start barefoot walking, your condition can get aggravated. So just be careful. In those people, I think wearing a minimalistic type of a footwear or a minimalistic footwear.
So you said about the flat foot. I have a cousin who is 16 years old. So he's suffering with flat foot and is not able to walk properly. So in this age group, what kind of remedies are available for the flat foot problem?
Very interesting point, and it is one condition of flat foot which is very close to my heart, and I've been a very big proponent of management of patients with flat foot in India. Okay, because Indian flat foot is different than Western flat foot. As of now, all the data which is available in the management of people with flat foot is from the Western literature or in pediatric group. In adult, so 16 is almost coming to an adult flat foot is different, because as Asians, collagen or ligaments are different. We are more laxer, we are more flexible. So that's why people have more lesser arch, let's put it that way, a lesser arch than a person who's developed, or a Caucasian or a European. So we are developed with a slightly lesser arch or flattish. But not every person needs treatment. Just because somebody has a flat foot and is no symptoms, is very active, doesn't need to come and see me. That's fine. 21% of Indian population is flat foot. That's a lot of patients. If everybody starts coming and seeing me, probably it'll take me 2 year life to see them. So I'm not saying you need to see them. But if you have symptoms with your flat foot, and the symptoms could be just not pain, right? Like 16-year-old, your cousin, he may not tell his parents or himself that he has pain, but there could be underlying symptoms like limited activity. He doesn't like sports, he doesn't like doing sports, he doesn't like to run, he's not very active in participation, he could be having a sedentary life. These are all symptoms of flat foot. So what we call these are psychosocial symptoms. If they are there, they should be treated. So a lot of my colleagues and say, oh, there is no pain, don't treat it. No, these are other things to be looked at and need to be treated. Also, because of flat foot, because of a misaligned foot, you can have a misaligned or a knee pain. You could have a back pain or a lower bottom buttock pain and the whole spine. So these are like a cascading effect of flat foot on the whole body. So these are symptoms which should be treated. How do you treat this? Not every patient needs surgery. Initially, simple things. Align them properly. How do you align them? Give them orthotics or insoles. Initially, if it is only mild flat foot, you can do off the shelf insoles. You can have silicone insoles, or now you're having off shelf insoles, you can use it. If they are not happy with that, then you have customized insoles. Pressure measurements are taken properly, both in terms of standing and while walking. We look at that pressures, where abnormal pressures are coming, and you offload them or correct them. In the past, we had a lot of people putting just a small arch in that. No, flat foot is a three-dimensional deformity. Just putting an arch on the inside does not work only. You have to correct the arch, but at the same time correct the heel. At the same time correct the forefoot. So it is a three-dimensional deformity which needs to be corrected appropriately with insole. So in my team, I have a orthotist which is trained with me, who works and sits with me for every patient whose insoles are made, and I make sure that that person is happy with that insole. Now the other common downside to it is patients are given insoles, they wear it, they come back after 3 days, my pain has increased, I don't know, I don't want this insole, and they throw it away. But understand, he's a 16-year-old boy or somebody who's 60. They have walked always flat foot like this. Now suddenly you tell them to walk in a different way. It will be very difficult. It's like buying a new shoe. Would you be able to spend the whole day in the new shoe? No, you don't. Same thing with insoles. You have to get used to it. So I tell all my patients, you wear only 15 minutes to half an hour next few days. Take it off, then again wear it. So your body gets used to the new alignment. I always call all my patients between 2 and 3 weeks again to check what is happening. Are they happy with their insoles? If they are not happy with the insoles, how we can correct it? And also initially we just do a mild correction. Once they are comfortable with that mild correction, then we increase the correction. It is all about a gradual process and a relationship developing with those people. Along with the insoles, physiotherapy or physical therapy is very, very important. You have to stretch some muscles and you have to tighten some muscles or strengthen some muscles which support the arch. Okay, one of the muscles which is behind on the inner side of the ankle, which is called as the tibialis posterior muscle, which is the key muscle which maintains the arch, that needs to be strengthened. That is the most important thing. If, lo behold, your 16-year-old cousin is still symptomatic or is not relieved of the pain in spite of all this, then we have to look at what other options can be done, like surgery. We can do minimally invasive surgery where the whole flat foot can get corrected by a small, less than a centimeter incision. We have a special, what we call as a stent, and I call it as like an internal insole, where through a small half a centimeter cut, I correct the whole flat foot and patients can walk from day one. Okay, that is called as a EOTTS or hyprocure. Okay, that's a arthroresis type of a procedure. Elderly people or older patients with severe deformities, if it is flexible, I can still construct or realign the foot and still maintain the mobility. It is called as a flat foot correction. That's what I do it, where we realign the whole foot, and they need to, it's a long process of rehabilitation. Takes around 3 to 4 months for them to get back on their feet and back to their whole life, but they are much happier. At least they're happy that the alignment is better, pain is gone, and future risk of arthritis is reduced. Now, there are some patients who have not taken care of their joints and come too late, where the joints are starting getting arthritis, especially around the ankle area. In those patients, there is no option but to realign it, but we have to fuse the joint. So we join the two bones. In the process, we give them a good foot, which they can walk on it, they can walk pain-free, but they lose a little bit of flexibility or mobility in their foot. But they are still better off than what they started with. So it's all about what you gain from the surgery versus the risk what you go through it. So that's in a nutshell about flat foot, but do not ignore it. because if you ignore your flat foot, it's just not the feet which is taking the pounding, it's your whole body which is going to get affected.
So as you said, for the 60 years and the 16 years of age group also is having the treatment. Can we at the initial stages only, like 4 to 7 age group, can we correct that flat foot?
Yes, usually few of my patients or the parents come with their children at a very young age and say, "Oh, I don't think so. He has got any arch. What do you think it is? Does he have flat foot? Shall we treat it?" No, actually, the arch development, or actually, if a person or a child has an arch or not, we can only start looking at it by age 6, 7. Before that, it is all baby fat. So I just reassure the parents, give them some exercises, give them some stretching, because strengthening is not possible, but stretching and other things, and reassure them, yes, we will be taking care of them, but they can come back and see me every 6 months and see how things are going by. If the deformity or the out of alignment is going more progressive, then we will treat it. Otherwise, just keep an eye on them. Age 7 is the time where we say, does this patient or this person has flat foot or not, and that requires treatment.
Thank you so much, doctor, for sharing us this valuable information. Thank you once again.
Thank you so much for having me on this show. I hope the viewers have found all the information useful. If there's anything, they can always contact us. Thank you.